Good afternoon, everybody. My name is FARIS, SABBAH, and I work as the County Superintendent of Schools in Santa Cruz County, right here to the north of us. I wanted to start with a simple statement, which is something I think you probably agree with, which is that connectivity is a lifeline for our students and our community. It's a fundamental part of what we do in education. It's a fundamental part of our advocacy on behalf of our communities. And we're here to talk to you a little bit about the transformation of connectivity as it relates to mental health and how the pandemic has really emphasized the need for us to think differently of the services that we offer and the deep impact these changes have had on our students. The pandemic was so deeply impactful, not only as a result of distance learning and our shift in education. It brought forth so many equity issues for us, and so many of our families and students were so impacted. And one of the things that we saw that was clear right off the bat was who was able to get connected and who wasn't. So we're going to talk a little bit about that part. But what we did with that connectivity was also something that was fundamentally important. We recognized very quickly that students were being isolated and needed to be able to connect with each other, with their teachers, and also with people who could provide them with therapeutic support. I believe that one of the positive things that came out of the pandemic has been a rethinking of what schools represent, that they're not just places of learning, places for student achievement, that they are places for support, places to provide a hub of resources for families. And if you're not able to connect with each other in person, then the resources, that information is going to be delivered through that connectivity, and that's why it's so important. One of the efforts that we worked on at the Santa Cruz County, and of course this happened all over the country and all over the world, was trying to figure out how we were going to get more of our students connected. We had almost 1 in 5 of our students without internet access in Santa Cruz County. Sometimes we think of Santa Cruz County, we think of well-off folks who live on the beach in multi-million-dollar homes. Well, it's a very agricultural county, very rural county, and we had a lot of families that struggled to be able to get connected. And immediately, as we all did in education, had to switch into a virtual mode for learning. We tell people to check their email, get connected, and recognize very quickly, of course, that many of our families were unable to get connected, and those families were the same families which were historically marginalized in other ways. And we worked really hard. Jason Borgen, who is our Chief Technology and Innovation Officer, worked in partnership with other school districts, with corporations in the community, with the Community Foundation to increase that connectivity. And we were able to bring the number down to about 3% of our students who were not able to get connected. But most of that connectivity, of course, was with hotspots. So it's not broadband. And we recognize that the connectivity challenge for us, that gap for the haves and have-nots is still there and still something we need a lot of work on. But that focus on getting students connected was something that opened up our eyes to a lot of the needs of our families. One of those needs that we identified for our students was this emotional strain that this new environment had put on them. We utilized the California Healthy Kids Survey for a lot of information. And statewide, what we found was that the increases in students experiencing anxiety, isolation, depression, suicidal ideation increased dramatically. And you could look at this data from a variety of different points of view, and it still gives us the same information that over the pandemic, our students were experienced trauma, experienced a lot of mental anguish, and had a lot of mental health needs that needed to be addressed. If you look at this data, you'll see, just even if it's hard for you to see the numbers, you'll see these big peaks year after year in different grade levels: 7th grade, 9th grade, 11th grade, and for non-traditional students. And these are students who are experiencing chronic sadness or hopelessness on the California Healthy Kids Survey. That last number there is 38% of students in non-traditional schools, 42% of 11th graders experiencing chronic sadness or hopelessness. We have a data portal in Santa Cruz COE where you can actually go in and check out the data. You can actually play around with it and answer questions. This information that is coming that we're sharing with you comes from our data portal. Here's another question that is asked on the California Healthy Kids Survey, which is, in the past 12 months, did you ever feel so sad or hopeless almost every day? And you'll see again that in the last column of each of those, so for 7th graders, you'll see that last year, which is 2021, you'll see these increases jumping to 36%. For 9th graders, 44%. 11th graders, 50%, and non-traditional students in our alternative programs, 55%, stating that in the past 12 months did they ever feel sad or hopeless. Now, this is just one question that was included in the California Healthy Kids Survey. And we're only sharing with you just a basic summary of that. If you dissect that data and start looking at subgroups, you'll find some really startling pieces of information. For example, when we look at the same data, when it comes to our LGBTQ youth, we see that they are 3 times more likely to have seriously considered taking their life in the last 12 months. 3 times more than the non-LGBTQ students. Over 42% have answered that question in the affirmative. There is a crisis in our community, and we have limited resources to address this crisis. And so we have moved into some exciting and positive ways of trying to address this crisis. One of those answers is telehealth. One of the ways that we're able to connect with our students is to take advantage of that connectivity that we're building and be able to create those bridges to be able to serve them and be able to provide connectivity to them. I'd like to introduce somebody who's been doing this kind of work at the San Diego County Office of Education. Somebody who is, her title is Coordinator of K-12 School Counseling Services. Please welcome TANYA BULETTE. BULETTE.
All right, thank you so much. It's great to be here today to share what we started to see in our county as far as mental health was concerned and how it was addressed. Well, that's fun. So this slide had some statistics on it that our Climate and Mental Health and Wellness Committee put together to share what was happening. And some of the biggest finds are not surprising, and that is that, thank you, here we go, that mental health was one of the top things that we really could see was something of an issue, and we needed to find a way to address it and to address it better. And so we knew we needed to find support beyond the classroom. And one study that came out was one that was done through the Harvard Graduate School of Education and the Boston College Lynch School of Education and Human Development. They actually did a survey to see what was happening across our nation, and they talked with many school counselors to see what was needed, what was happening, and where were there some barriers. And so the pandemic highlighted, of course, a need for wellness in a virtual setting. Now that's very new to many of our educators as well as school counselors. And so technology both supported and posed barriers to school counselors. And as the counseling coordinator, my role was to find out what was happening at our school sites, what was happening in our districts. How are we connecting with students and families? And so there were a lot of things coming up, a lot of uncomfortable feelings, and that's as educators are also dealing with their own families and situations. And so what we really quickly found out was that school counselors definitely needed training in effectively using virtual platforms. This was completely new to them. And of course, they were being asked by students and families, how do we use these virtual platforms? So there was a lot of confusion and a lot of quick study, and we had counselors that were very comfortable with technology and counselors who were not. About 60% of the counselors that had access to laptops pre-COVID, there were also 37% who had to rely on using their own personal device. So again, some school districts provided laptops and technology, and they were able to shift to home and continue with their work, while others did not. And I remember back when I was working in a school district and they had just come out with issuing laptops to all the teachers, school counselors were left off the table. And so that was something that we had to continuously advocate for. But still there was this, we had many districts that did not have that. And so that was another issue that needed to be addressed. And then while counselors generally were able to access devices and sufficient internet connection, they faced, of course, a lot of technology-related issues. We had many school districts that are out in very rural communities where internet was very difficult to have. And so there were a lot of barriers in that aspect as well. And then about 20% of counselors were unable to virtually connect with their students. And we saw that all over our county, as well as I'm sure everyone saw all over the state. And so mental health resources were something we had to quickly come up with. And so we were communicating with our districts on a weekly basis. We were pumping out as much as we could with all the resources that were coming down. It was a very confusing time. So making sure that we had resources that we could get out that were 1 or 2 pages was definitely a benefit. And then this was a great website because it provided a virtual way to screen. You know, a lot of times parents don't know if their student is ADHD, or they want to just know, and they come to the school first to find out. And so this was a great resource that we could provide to parents, where it was basically asking a lot of questions, and then they could get that information right away and then connect with a physician to see if they needed further testing. So a lot of wonderful tools came about that, again, were very helpful in not diagnosing, but helping us to see whether their issues might be out there. And then in our county, we had one district that actually put together an online school. You know, before the pandemic, I always, as a school counselor, had questions from students and families saying, I feel more comfortable if I could just have an online program at home. And it wasn't a lot, but it was enough to where some students and families would prefer to have that homeschool type of experience, but it wasn't offered through many districts. So this school put it together, and they had 250 students when it opened in the spring of 2021, and then last spring it almost doubled, it doubled and more to 750 students. And the smart thing they did was they made sure to have a counselor. And then they added a second counselor because, of course, there were a lot of mental health issues and they didn't want to see those slide or not be addressed. So they put together electronic forms, assessments, again, things that and tools that counselors are not very comfortable with that they had to learn how to use. And so it was a lot of learn and go. And these type of resources, though, when they were very simple, allowed for school counselors to be successful with them. And then we'll start talking about some of the wellness centers that started to come up. Our county put together a virtual wellness center, and then we started to see that as that was going up, other districts were adding those links to their websites and promoting it to their students. And these are wonderful resources that are all available where students can do a quick meditation or do some deep breathing all on their own, and it has videos and resources to lead them through that. So this was a wonderful resource that was developed that many of our, like I said, districts adopted as well. And then this report just came out last August, and we're going to talk more about it as we get to the end, but very exciting to know that our governor has put in place funding to provide more positions for more school counselors to be enlisted and hired in our state. And so he has the budget and the money, it's not just as though it's being talked about, to actually put forth to where we could have about 10,000 school counselors added into our state within the next few years. And so this is just another state. Another great win was that they updated language around school counseling to include the fact that school counselors have 3 domains, not just academics, not just college and career as part of the resources that they provide, but also in the mental health capacity. School counselors are trained, they have the credential for it, they just need to be accessed and tapped to use that. So that's also exciting that a lot of language around MTSS, PBIS, all of those things are added now into Ed Code to completely address the role of a school counselor.
Thank you, Tanya. As we're going to be shifting in a moment to talk to a panel of folks who've been actually doing this work over the last few years, I wanted to share with you just a couple of things. I also work as the chair of a federally qualified health center in Watsonville, the largest one there, Salud para la Gente. And telehealth was something that also transformed the services and the ability of the reach of this FQHC to be able to serve the population in Watsonville. And this is a quote from a young person who talks about the traumatic experience of the pandemic. And so we often, we now use terms like PTSD and trauma and to describe the experience of so many young people, folks who've lost loved ones, folks who just are experiencing fear, social anxiety, they're unable to leave their homes to be able to participate. And we are seeing a huge influx in our alternative programs because students are being otherwise unsuccessful in the traditional programs. And the biggest game changer for those students is access to counseling. And so the reason we're talking about telehealth and we're bringing it here to CENIC is because we're talking about how to provide a much more significant quantity and quality of mental health services at scale through connectivity. And we think that telehealth offers one of the answers to this question. We have seen it kind of by force. We were implementing it across in a variety of different places, and we see it as something that's going to continue to offer our ability to be able to overcome many of the challenges that we've experienced during this pandemic. So we'd like to ask you a question, and we were going to do a survey, but since there's a few of us here, maybe with a show of hands, before the pandemic, how many of you had experience with telehealth, where you actually interacted with your doctor or any other care provider? So about half of you. And during the pandemic, up till now, how many have experienced it? Almost all of us. Okay. And so that transformation is happening everywhere. It's affecting everybody. And I often now, when the first question they ask me when I call my doctor for an appointment is if I'm willing to do telehealth, right? And for many of us, that is so convenient. I think that as we think about what it means for folks who are either unable for a variety of reasons, or maybe just because of the limited resources we have, like the number of counselors. We are struggling in our schools to be able to keep up with the number of counselors. We have so many waiting lists. And so we're constantly looking at ways to maximize the resources we do have. And again, telehealth may offer some of those answers. Some of the other areas that we've been working on, things like connectivity, devices, high-speed internet so that we can offer broadband, overcoming the language challenges that such as we have in our community families that speak Mixteco, which is an indigenous language in Mexico, mostly in the state of Oaxaca. Being able to make these resources as available as possible. And in some cases, telehealth has actually facilitated that. I was recently having a interaction with a parent who was very concerned about they were advocating for their child to repeat the school year. They were in middle school, and we were explaining to the parent who spoke Pakistani that really middle school retaining students is not something that's often done, and it's not usually in the best interest of students. But we were able to, using communication through interpretation, we were able to use the technology to facilitate that conversation, right? And so being able to use the resources to overcome for language is an important use of this technology. And of course, the space challenges, having facilities to be in place to be able to offer students the space, whether virtual or in real life, being able to have the proper space for, and that's one of the many challenges we experience. In some cases, we have counselors who are having to negotiate at the school site to ask somebody to leave their space for them to be able to have a small cubbyhole to be able to sit down with a student and have a conversation. Again, we think telehealth offers some solutions to this. So it's now an opportunity for me to turn the attention to our panel. We're going to be asking some questions. Folks who've been working in the field and providing or organizing, coordinating, designing services for students. And I'm going to ask each of them to introduce themselves. And I'm going to start with Terry on the far side, and he's going to tell us just a little bit about himself and his interest in this area.
There we go. Thank you in the back. Always appreciate our IT people. Good afternoon, all. My name is Terry Loftus. I serve as the Assistant Superintendent, Chief Information Officer for the San Diego County Office of Education. I also have the privilege and honor to serve as a board member for CENIC. And at the San Diego County Office of Education, we, like all of our counties across the state, have been grappling with not only the challenges around distance learning and keeping our districts and schools and charters running operationally, but meeting the mental health and physical health needs of all of our students and our staff as well. So very happy to be here and be part of this conversation today.
Hi, my name is Rusilia Madrigal. I'm a licensed marriage and family therapist and co-owner of A New Hope Family Services, as well as having the privilege of being a clinical supervisor of one of the largest nonprofits in the area who also do school counseling.
Sorry. No, it's okay. Hi, everyone. My name is Haley Newman. I am the School Climate and Wellness Coordinator for the Santa Cruz County Office of Education. I help support districts with school climate and wellness services and pending wellness centers in Santa Cruz County. And I formerly was serving a district that utilized telehealth in their wellness center spaces during the pandemic.
And again, I'm TANYA BULETTE, Counseling Coordinator for San Diego County Office of Education. And prior to my role, I'm going into my 4th year in this position, I was a high school counselor for 20 years in one of the districts in San Diego.
Thank you so much for joining us. And I have the first question, and I'm going to direct it at Rosalia. The first question is, what are the benefits of telehealth for students at school, and how do you make it as seamless as possible for students?
Well, being a therapist in private practice and being able to see students sit on waiting lists nonstop is a difficult thing. So anytime we can provide access to students in the school setting, we're just providing them the tools that they need to be successful. One of the things that we noticed was a stop in school counseling when we went to completely virtual settings, at least in the county that I was working for. And we had to scramble together and try to figure out how to get the school counselors and the socio-emotional counselors and the therapists and the students and how we could get them connected. When we were able to get some telehealth services in place, we just saw an increase in students being able to show up for class, being able to focus and have attention, not to mention just the health benefits of their own state of well-being. So anything that we can do to provide access to students across the board in a telehealth setting is going to be a benefit. How do you make it seamless for students? Again, it's the access. It's providing the hotspots. It's providing the broadband. It's providing the computers, collaboration between therapists and administrators and socio-emotional counselors, and providing that space. That was a huge issue in the county that I worked for, was having the space for students to be safe and secure and be able to talk about their thoughts and their feelings and their fears. And as you mentioned, struggling to find just a cubby where they could feel secure and not in their principal's office to go to therapy. So this telehealth service offers the ability to have multiple students in like an area where they can have a one-to-one session with a therapist and yet feel that they are being secure in what they're sharing. So,
Thank you, Rosalia. I'd like to open it up for anybody else who would like to add to the benefits of telehealth.
So I think there was an actual increase when telehealth came out. And I say that because, as a practicing school counselor, many times students and families didn't want to go physically to the school, to a counselor that maybe they haven't established a relationship with, to share some of these struggles. And then when you have telehealth, you have an ability to go online, see the form, fill it out, and it's all very seamless and you can make it very confidential. And so I think it increased it because it allowed for more people to come forward and not have to physically walk in where they feel that all eyes are on them.
I think to add to that thought, the benefits of telehealth can be shown at both in-person campuses as well as online campuses. So we heard earlier about virtual academies, right? And there's a lot of those spaces across districts in California that's new from the pandemic. So having those online school settings. So telehealth helps provide mental health for those students. And I am hopeful that there will be more access to telehealth services for students at on-campus sites. And like was mentioned, the seamless part would be allowing that space for students to attend their telehealth sessions. Thinking about families holistically, it also removes barriers of driving from one place to another, especially for our working families.
And taking a quick step back from the benefits of telehealth and what we're discussing here today, it's important that that information is also bubbled up and shared with others. So right now, if you're in K-12 education, higher ed, other areas, it's very much a time of plenty, right, as far as funding and resources. That was not the case the first year of the pandemic, right? Everyone was scrambling. It was a time of crisis. And so in San Diego, and I know in other areas as well, as we sought out additional resources. So in San Diego, we were able to obtain an additional $3 million from foundations from the County of San Diego itself, so that we could support hotspots and other connectivity mechanisms through cable and other providers to provide devices to students, because, and part of that narrative was beyond just the instructional piece, right? That was the first thing the general public saw, right? When their kids had to come home and parents were figuring out, all right, how am I going to provide instruction to my child or children? And that was very valid and still remains so. But as we quickly saw, it was a much broader set of needs that we were looking to address through connectivity and devices, and that included counseling support, mental health, even physical health. When we had carriers saying, hey, we have spun up, whether we're Kaiser or Sharp or whoever, and we're offering telemedicine now, well, if the student doesn't have connectivity, doesn't have a device, they are cut off from that access. And so it very much is an equity issue. And so when we talk about the benefits of telehealth, it's good for us to recognize and discuss in places like this, but also as we have those conversations with broader groups, philanthropic organizations, our local and state legislators and others. Because again, for us it was very helpful to have that broader conversation about the needs of our students, their families, and the broader community when we're thinking about telehealth.
Thank you so much. As we're looking at what schools can do to support students and increasing that in relation to technology and mental health, one of the things that comes to mind immediately is stigma, the concern about the concern that students may have or families may have about needing mental health services. What are the kinds of things that we can do as educators to help make these resources more available? And what are the kinds of things that we can do to prepare our schools to be able to be better deliverers of these kinds of services?
Yeah, so I think I touched on it previously when I was going through some of my slides. There definitely needs to be a training for the educators. That was a huge concern. It evoked a lot of anxiety amongst educators. How do I do this? What is there confidentiality laws that I need to be paying attention to? So there were a lot of pieces and a lot of unknowns. But I think working through and being able to provide those step-by-step instructions, being able to provide support and processes really was found to be very beneficial when we were starting to roll out some of these pieces. So that educational component, so that they feel strong enough to be able to share with their students and to share with their families how to go about accessing the resources was a huge component and one to be addressed.
For me, again, as a technologist, really thinking about the challenges for the practitioners, whether it was a teacher, it was a counselor, it was someone providing special ed services. They are the subject matter experts in those areas, and they had to flip what they were doing on a dime, right, with everyone at the beginning of the pandemic. And so thinking about when we're talking about supporting students, it's that training around the usage of devices and being safe online and digital citizenship and how to connect in a safe and confidential way with a provider, and also the element in providing support to the staff that are supporting those students, right? So as Tanya mentioned, and rightly so, we were, as a K-12 education community, way behind the ball when it came to providing proper devices and resources to staff, whether it's training, devices, connectivity, and so being mindful of that, I think, as something that's ingrained in what we do on a daily basis, is prepares us for things that might happen in the future, which we'll talk about the future a little bit more on the next slide. But that really is a key thing. And one of the items, too, that we found is, again, kind of sticking within the vein of connectivity and remaining on technology, is a lot of our students had devices like Chromebooks that were kind of the least expensive option that we had used for years. And we found out at the beginning of the pandemic that, oh, well, they were under-resourced, and you couldn't use those to video conference with your counselor or to engage with health services because it wasn't powerful enough to do that, or it didn't have the right connectivity to do that. So I think as we're thinking about preparing educators and students and everyone else involved in this ecosystem, it's to have the right tools, right? So those are move out of the way. Those are just kind of a default thing so people can focus on what they need to.
I don't know if I have anything much to add to that one, but I would say regarding working with students, depending on the age level, but really advocating for technology needs, so building off of what Terry mentioned. Some of our students that want to access mental health may not have the technology or the space at home, especially if they're an online student. Knowing equitably, some of our students are in multi-generational homes and may not have a confidential space in order to receive these mental health services. However, on the other end, as we prepare our educators for expanding telehealth as well as providing mental health through technology, really it's knowing what their needs are. Through their expertise, whether it's how do I deliver an intake form virtually, how do I give the screening tool virtually, to how do I teach families how to access this online portal to receive mental health services. So all of those nuances are so important, especially knowing, can we explain this in their primary language in order to make them feel more comfortable with mental health, knowing that for some of our families there is a stigma around mental health, and perhaps using their language and talking about these mental health services will make them feel more comfortable.
So as a follow-up, what kinds of resources do we need to invest in to be able to increase the technology? You mentioned that we need to increase the technology and support. So where does, what kind of investments do we need to make when it comes to professional development, when it comes into resource allocation, when it comes to getting the word out, outreach to families and to students?
I guess I'll jump in first. So for me, it always goes back to people, process, and technology, right? So the professional development piece is always key, and sometimes that's the thing that falls to the wayside, right? Schools, school districts, even higher ed or other entities think about the technology, right? The laptop or the whatever, the hotspot. But it really is about the human beings, and so the professional development piece, getting people comfortable, whether it's students or staff, and utilizing whatever that technology might be. The other piece, and this is a thank you for the tee up here, but this is the work of the Golden State Net that CENIC is doing right now. The governor, California Department of Technology, and CENIC are dedicated in the coming years to connect every single corner of our state to fiber and broadband connectivity. And again, having that part of the equation solved, so that's not something that you have to contend with or you're bumping up against as far as an obstacle or a barrier as a provider or a practitioner, is going to be a huge step forward for our state. And I'm very excited as to where we're going because no other state has achieved this yet. And so from the people part, the training piece, the technology as far as the network and the connectivity, and then really that process part of being strategic in our thinking, right? And thinking about How are we maintaining devices? How are we providing the tools that are needed? Even thinking about, we had issues with students that need assistive technologies. Like, how are we thinking about those in the context of beyond just using them in a school setting? Maybe we need to think about what would that look like in a home-based setting or in some other physical setting outside of campus. So that would be my response to just kind of topically about how we can address some of these items.
And if I could add just like a clinical perspective from some of the experience I've seen with students, just the connection part from like the student to the teacher, where the teacher recognizes that the student has a need for mental health services, was also something that we noticed took a very long time for that turnaround to occur. Students weren't in the classrooms face to face with their teachers every day. They weren't seeing 15 adults walking every day. They were, in their room, in their bed most of the time with their screens off. And so they weren't showing up for class. Then teachers didn't know why, and we didn't have any processes in place where we were able to track why these students weren't coming to class and showing up. And so having the technology where you can create these like wellness rooms or centers, and you have the socio-emotional counselors being able to train teachers like, hey, if your student's not showing up 3 days in a row or their screen's off for 5 days in a row, maybe touch base with that student and see if there's a service that's needed there. So just from a perspective of just connecting that student to the service alone with the teacher's education is so important.
Thank you so much. Now let's shift our gaze to the future a little bit. What do we see in the future of supporting students' mental health with and without telehealth? What are we looking at in the next 5 years? Haley, you want to start us off?
Sure. So I think the vision in looking into the future for student mental health has to do with schools being really those centers of wellness. So what does it look like to offer those moments of wellness with students throughout their day, whether it's in the classroom, with a school counselor, with different staff throughout the building, but also knowing that there is a space on campus that students can go to get mental health support. I know in our county in Santa Cruz, that is what our vision is to create wellness centers starting at our secondary high schools so that students can receive on-campus services. The research shows that students are more likely to receive behavioral health and mental health when it is on campus. And it's easy to receive. There's less barriers to transportation, as well as trying to navigate the system of commercial insurance plans or Medi-Cal and trying to find someone to talk to. So we do hope that there is an open door. So no matter who I'm talking to, they're going to be able to link me to different mental health services. We also hope that there is less mental health stigma among our campuses because it will be a normalized part of the school culture. As far as telehealth, we're hoping that, and we know that the state is investing in more telehealth services and broadening the profession of behavior and mental health clinicians. And so the hope is that there are places on school campuses that students can go and get their telehealth service and go back to class to get their instructional minutes. What other visions do we have?
Well, like I mentioned in the slides, I foresee that more districts will be opening online schools. Like I mentioned, that was a need that I saw before the pandemic. And now that it's an option and we have schools that are making it happen and making it work, and with increased connectivity, with more students having computers provided to them by the schools, it's allowing for a different learning environment. And so with that increasing, of course, the need for having telehealth, for having those online wellness centers, before the pandemic, we had a conference in San Diego for 450 school counselors. It was literally 4 days before the shutdown. And we have on tape an interview of different counselors asking, what are you seeing in your schools? And mental health was on the rise then, and we were talking about anxiety as, wow, this is just, I've never seen it like this before. And now, of course, we still see a lot of these issues, but there's a spotlight on it. And now more people are talking about it. And we see that with our athletes, with Simone Biles pulling herself out. And so because of that, that stigma is getting less and less, and more people are coming forward, which is why we're seeing such an increase as well. So with that, I think we're going to start to see different learning environments and different ways that students are going to learn.
Thank you both for your for that vision, and we are going to have to keep moving forward because of our limited time. But just so grateful for all the great ideas, thoughts, experiences that you've brought to share with us today. As we look to the future, you know, I think that it's important to note that a lot of, as Harry said, there's a lot of investment going on right now in mental health services and resources. But we also know that many of these resources are temporary. And so looking at sustainability, when we look at the governor's plan, he has outlined some ideas in the governor's plan when it comes to having a virtual platform to increase accessibility to mental health, intervening early, increasing the number of counselors, expanding clinics and slots, suicide prevention and services to those with service needs. The idea is, of course, increasing the services, shortening the distance between need and service, and I think that commitment is coming from the governor's office, and there is funding that is available at this point for that. But we are also looking to the future. Are we going to have those resources later on? Wanted to share with you also that, as Haley mentioned, we are joining the bandwagon of creating wellness centers at our school sites, and we see that both as locations where students can walk in and get those services, but also a place where telehealth services could be offered to students. And so this is something that we're looking in, investing in Santa Cruz County, and we see that this is a collaborative that is going to take everybody from the community, from foundations, from government agencies to work together to build these safer spaces for students. We're really excited about it. We see it as part of the future of rethinking our schools, and we find it to be a place that has been successful in so many places, and we need to replicate this model across the state. Oh, I'll go back for you. There you go. There you go. And so this is actually a design of one of our wellness centers that we're working on for this school year. We'd like to open it up for questions from the group. Who'd like to come on up and ask us a question? If you wouldn't mind introducing yourself and then asking us your question.
Lauren Hare, and I'm a consultant. And I'm wondering two things. One, does your concept of telehealth for students include physical well-being as well as mental well-being? And my second is the pandemic has certainly catalyzed 10 years of progress in telehealth in 2 years. There are a lot of smartphone apps being developed for telehealth, and as well as mental health and behavioral coaching, measuring various parameters, more than just talking. And so where the app recommends you speak to a counselor, or the app might, if you're dealing with substance abuse, might coach you and give you rewards and make it a game and all these other approaches. Are you looking at those sorts of things, that is physical well-being, and as well as these smartphone apps is my question.
I'd like to just answer part of the question, which is I think that we focus today on mental health, but there is a community schools movement that is taking shape in our schools that is a much broader, has a broader approach that includes mental health as part of that. That includes medical needs. It includes addressing needing food, housing, and other needs. And so schools are developing as community schools to be able to offer a much wider range of options and services, including having medical providers on site at clinics to offer students and services for their medical needs as well as other kinds of health needs. And so I think that this comprehensive whole child approach is something that goes beyond just the specifics of mental health needs. And I think substance use is something we've been greatly concerned about and something that we've been working on deeply to increase the services as well as awareness for families and for students. And I don't know if anybody would like to add to anything I've shared. Thank you. Another question, please?
Yes, I'm George Heckman. I'm a UCSC graduate, amongst other things. And my question is playing off what was just discussed by the prior question answer and what you went through, Faris. Is, in terms of telehealth, what movements are afoot towards more closely integrating with telehealth services of the medical community in general? I noticed that, being able to build to insurance, certain services, being able to engage, or escalate certain situations in a more seamless fashion, say in the context of your wellness center. Is there a move to, have a more of a integrated and seamless care coordination, via technology and all of this?
I think that there is a movement. I think we have a lot of work to do. The challenges of, the limitations of HIPAA and FERPA and the kind of the sharing of data, there's a lot of work that has to take place for us to be able to have a more seamless approach to services. I would like to share something that you mentioned early on in your question. The first part you were asking about, as part of the question was I wanted to share something and I've lost it. Darn it.
Did it have to do with telehealth with physical health? Or?
Telehealth with physical health. I did want to share with you that what we have seen in not only in schools, but the amount of telehealth that we're learning a lot from FQHCs, the federally qualified health centers. And one of the challenges that we face is that when you have all of these different providers in a location, the ability to be able to share information is limited, right? Because each one has their own electronic health record, and there isn't necessarily a mechanism and so creating memorandums of understanding to create a more seamless landscape is something that we've needed to work on to try to increase. And I think that so this is one of the areas of growth that we have for us in this realm.
To build on that, so like Faris mentioned, the data sharing is really important, considering the apps that you were mentioning, also the physical health components. And so I think that we're starting with behavioral health and mental health because of the data that we've been shown today and what's coming out of the pandemic. But we're hopeful, especially with the communities grants that were talked about, that there's going to be a more comprehensive wellness around a student. However, when it comes to what you mentioned about intensifying support, right, for a student, if they need more than what we are able to provide, that's where the linkage comes in.
And I wanted to add something that I just remembered. You asked about insurance. And so at this point, we can only charge for Medi-Cal services, but at 2024, schools will be able to charge insurance providers. And that's going to be a game changer for us in that we're going to be able to not only serve folks who come from low-income backgrounds, but we'll be able to serve folks who also have insurance. And that's going to allow us to be able to sustain a lot of the services that we're talking about.
Let's do one more question. I know it's time for break, and I'm sure these folks will be available to speak with during break.
I'd just like to commend to you a company called Truveta, Truveta, which is started during the pandemic to exchange health information, to allow informatic analysis and sharing of data between hospital systems. And it's growing rapidly because the data works best when it's shared.
Truveta.
There are all sorts of interoperability problems and patient confidentiality and patient data protection issues. So this company has been started by hospital CIOs to enable shared analysis of their data stores. So,
Thank you. Last question.
Thank you very much for sharing this. I'm Julie Judd from the Ventura County Office of Education, and we are in Ventura County building centers as well at our schools. I'm curious, is your vision of your centers to service the whole family, or are you only focused on the registered child at the school?
At this point, our initial effort right now is specifically for students, for mental health, is for walk-in centers for students. However, that bigger, more comprehensive community schools approach is to serve the whole family. But right now we're starting with a very kind of a laser focus on students at high schools. Thank you.
If I could add,
Yes, please.
so one of the positions that I'm privileged to do is to supervise some of the interns. And in Pajaro Valley, they just opened 2 centers that are actually treating the whole family. And so it's going to be supervised by clinical supervisors and then staffed by associate therapists who are working on hours, and so they can provide these services for free with grants that they have throughout the county. So it's pretty cool.
We'd like to thank you so much. Please give a round of applause to our panel. Thank you all for joining us. And if we have any questions, our emails are here, and we look forward to hearing from you. Thank you so much.